you're instrumental in setting up the Rome Foundation.
Yes.
Can you give me a brief outline on where it's up to now and its current developments?
The Rome Foundation is an international nonprofit organization that's mission is to help patients with functional GI disorders. And we try to do that by promoting scientific investigation in the area, supporting research, and also educating. What we have done is much like in psychiatry, where you have the categorization of these diagnoses, DSM 1, 2, 3, 4. We now have Rome 1, 2, 3, and 4. Mm-hmm. Rome 4 was launched last May, 6 months ago. And Rome 4 is now the categorization of these disorders and the use of diagnostic criteria. See, the foundation began about 25 years ago, and at that time, when you did studies on these functional GI disorders, you'd have some patients with pain, others with diarrhea, others with constipation, and they were so heterogeneous you couldn't determine if a medication was helpful or not. But by precisely defining and classifying these disorders, that allowed for the FDA in the United States and the EMA in Europe to say, we now have a handle to do the research. And that is what led to the development of the functional GI classification system. And since that time, we're now moving toward education of clinicians, not only using the criteria, but through teaching them how to make a diagnosis through algorithms and how to do treatment from a multi-component framework. So it's a lot of work.
Sure. Presumably, part of your remit is to get medical students through to qualified physicians to actually take on board the concept that we've now probably beginning to accept that there is a very close relationship between psychosocial symptoms and physical symptoms.
Yeah, and it's really a tightrope. We don't want to give across the message that these are psychiatric conditions. They're absolutely not. They're not related to psychiatric only as much as psychiatric conditions can worsen the symptoms. But it's a problem in the regulation between the brain and the gut. This is where we're looking now.
Would it be more accurate to say psychological and that behavior is involved in it?
Well, we say biopsychosocial.
Right.
Okay, so we have the biologic substrate, and psychosocial factors may amplify or modify. And it works the other way too. Conditions like hypnosis, cognitive behavioral therapy are well recognized to improve the symptoms by giving patients a better sense of control and also by actually affecting these brain-gut communications.